What we're going to do now is move into a special session that has a representative from the World Health Organization. We're going to be talking about opportunities for elevating the voice of people living with non-communicable diseases across the World Health Organization and the United Nations. We're very pleased and very honored to have Maia Olsen. Maia serves as a technical and implementation consultant for the World Health Organization. She's very involved with the global coordination mechanism on non-communicable diseases. We were first introduced to Maia and her team in 2022 and throughout 2023 when AAKP had the opportunity to be involved in the People Power series of the WHO. And basically what this did was created a format and a mechanism for making certain that patient voices throughout the world were included in the internal deliberations of the WHO and the UN. I think you'll find this session very interesting. Thank you very much, Maia, for being here, and we're honored to have you as a guest at our Global Summit. We're so very excited. Our engagement with WHO began back in 2022, and I know that you were an instrumental part of that. So not only with AAKP, but with patient advocates around the globe, we've had an opportunity to participate in WHO meetings, help form publications, the People Power series, and other types of things that you've been working on. And I'm very curious for you to tell us how within the WHO, those types of patient engagements have impacted operations from your perspective.
Yeah, it's a great question. And I think we got involved around the same time. In May of 2023, the WHO framework for meaningful engagement of people living with NCDs, mental health and neurological conditions was launched, but that was part of a 3-year consultation process that involved over 750 people, about half of which were people with lived experience, and it also included really interesting participatory research like you were involved with in developing the People Power report. Your interview with Anu Gamanju from Nepal around power imbalances kind of illustrated not only lived experience expertise, but highlighted some of the principles and enablers that ended up in the framework. The framework has been a really useful document for the World Health Organization and for member state governments. It outlines principles and enablers for meaningful engagement, addressing stigma, how to formalize structure, sustainable financing, capacity building, those types of technical areas where recommendations are needed for implementation. But it also kind of provides a reference, a mandate around a rights-based participatory approach. And we're continually getting I work in the WHO Global Coordination Mechanism that helps support implementation of the framework. And we're regularly asked by teams and by governments about how to move forward certain sections, how to interpret things like the sustainable financing resources, how to involve people in technical committees. Those sorts of normative guidance is very, very important, but it also for advocates sets a mandate that they can kind of keep WHO and keep governments accountable and say, hey, we all decided on these things in the framework. We'd like to see this move forward more in Nigeria, in the US context, in Nepal, in kind of across countries, across regions. With the framework out, the biggest focus has been to make sure that that is not a piece of paper that sits on a shelf, and kind of transitioning the community that helped co-design the framework, which was largely led by people with lived experience, into a coalition building and advocacy multi-stakeholder platform has been the real emphasis since the framework was launched. And so we have supported the WHO Symposium on Meaningful Engagement that's been very focused on the UN high-level meeting political process, which I'll talk a little bit more about later. But that in and of itself is also being led by a 9-person steering committee of lived experience experts who are in paid and compensated roles, which is, again, shows that culture shift. There's a lot of capacity building still needed. There's a lot of areas where we are late to opportunities for meaningful engagement, and there's lessons learned that, but there's just as many opportunities where we're seeing from the front end of the development of a toolkit or a platform or guidelines. We have countries in the Eastern Mediterranean region that are looking at mental health support for cancer patients. You know, the opportunities are endless in terms of the ways in which lived experience as expertise can be more integrated within policy setting at a high level, but also implementation of programs on the ground in the countries that we support as WHO. So it's been an exciting thing to be a part of, and I'm glad you've been there from the beginning as well.
Yeah, no, we're very excited about it. And, there's a tremendous amount of interest. We've seen, as AAKP and as our patients around the world know, a lot of excitement building on what the fourth meeting here is at the UN General Assembly. And it's the fourth high level meeting. And I'm very interested in how WHO interacts prior to that meeting in preparation, I guess. And what mechanisms WHO is able to bring to the table or bring the voice of the patients to that process to inform some of the deliberations there.
Yeah, absolutely. And for those that aren't following the high level meeting process, it's actually a fairly rare occurrence to be the high level meeting. It's at in front of the UN General Assembly. It is an opportunity for heads of state, so it is at that highest political level to make commitments around the NCD and mental health agenda. There's been other meetings focused on HIV and universal health coverage, tuberculosis. But it's not only rare as a mechanism, again, at that head of state level, but it's also even rarer that we've had 4 high-level meetings for NCDs. And unfortunately, that story there isn't as positive as you would think it would be. I think one of the things that's been a struggle for those of us in the NCD and mental health agenda is that the ambition has not been high enough. It's not been inclusive enough. There's still quite a bit that has been lagging in progress across countries. And so this meeting is as important as ever in terms of making sure that there's an ambitious agenda that carries us through 2030, but also beyond that. WHO helps to facilitate that process through a couple of different mechanisms. There is a WHO office at the United Nations in New York that helps the President of the General Assembly, which right now that's a rotating seat. It's held by Cameroon right now. And then the 2 co-facilitator governments, which are Luxembourg and St. Vincent and the Grenadines for this year's high-level meeting. We certainly also provide technical contributions internally. There's different milestones on the calendar. The Director General's report is something submitted by Dr. Tedros. In the winter, there were technical inputs that were provided by the organization this spring. But then the other big thing that we focus on is multi-stakeholder platforms and opportunities for civil society, people with lived experience, and other stakeholders to be able to be in conversation with governments through the political process. So we actually just had a multi-stakeholder hearing on May 2nd, which was a really important opportunity for civil society organizations. And then I think we had 15 to 20 people with lived experience who had speaking roles, which was really, really exciting. I was there in New York helping support that, and very proud of the content of the discussions that came through the voices of people affected by these conditions. But right now, the zero draft is out. There will be links available for people to look at. There's multiple sections in the zero draft: health promoting environments, strengthening primary health care, increasing sustainable financing, strengthening governance, and strengthening data and surveillance. Disease-specific priorities tend to be sort of filtered through a very health systems lens. I did look up right before this conversation, and there's no direct reference to kidney disease, but so much of the health systems components is relevant. And so I would really encourage those of you within your organization and across your networks to take a look at the zero draft and to be in conversation with the missions in New York, with governments and ministries of health on the ground in the countries and regions that you work, and then certainly from an American context, being involved in that as well. We have also been running the WHO Symposium on Meaningful Engagement, which over the last year and a half has brought together around 200 to 300 advocates, depending on the meeting, to really deep dive into a shared set of priorities around meaningful engagement. And so another one of the links that has been shared is the 12 asks that came from the lived experience community across communities, across conditions, across regions, including lived experience advocates with NCDs and mental health, as well as neurological conditions. And one of the things that we're helping to facilitate through that coalition building platform is an avenue for the lived experience community to be in front of member states. We had meetings in April where we had about 150 advocates in technical meetings with 41 governments that are involved in the negotiations process. And so continuing to look for opportunities where we can facilitate that, but more so amplify the priorities that are being set by the communities, community, both through civil society organizations as well as through people with lived experience. So a lot of opportunity to still influence the agenda, but we are coming up closely on September 2025.
Yeah, and well, the reason why we're excited about this is because increasingly what we're seeing as kidney patients and as medical professionals and researchers is this convergence, getting out of the silos and better understanding how heart, kidney, and metabolic diseases are interrelated. Certainly as patients, we know that quite well because we often end up trying to stitch together our experts to get a comprehensive view of what's going on with us. So it's nice to see it actually taking shape internationally. Yesterday, on the first day of our summit, we were able to have a conversation about an emerging international coalition on heart and kidney care. And this has patients as co-chairs from all over the world. A lot of different NGOs are joining that, and we're excited about it. But what it points out is that there is a growing movement in research and development and science and new products that will address multiple organ conditions. And I think as you take a look at the agenda, and let's say kidney patients and researchers and doctors are out there and say, hey, we don't see kidney disease. It's kind of a more sophisticated view, basically, that you're offering and saying that, hey, look, you do have the opportunity to impact. You do have the opportunity to raise new concerns and actually shape this going forward for that kind of emerging coalition, International Society of Nephrology, American Society of Nephrology, our organization, and others. What do you think the best channel is? Keep engaging with WHO and the different platforms that you're offering?
Yeah, I think there's a couple of different challenges. Certainly, come join us at the Global Coordination Mechanism with the symposium. We obviously, I focus mostly on our meaningful engagement work. And so for those that really want to build out and co-design that with us, it's a huge opportunity. But the Global Coordination Mechanism in general has a really sort of broad-basing focus across multi-sectoral and multi-stakeholder collaboration and setting priorities. And so I think technically it's a great place to sit across academia, across private sector, across civil society lived experience. And so there are definitely those technical platforms within WHO. In the context of the high-level meeting, one of the starting points that you mentioned is those global coalitions and advocacy. We certainly work a lot with groups like the NCD Alliance and United for Global Mental Health as civil society organizations under the GCM, but the International Society of Nephrology, in an American context, the Global Health Council, UHC 2030, some of these civil society-led platforms can be a really great place for amplifying some of the messaging and setting some of those priorities across civil society. And then I think the other thing that I would recommend, particularly in the context of the high-level meeting, is it feels like an intimidating process, but it's not actually as opaque as you think that it is. There are member states, ministries of health in across regions are really often interested and eager to hear from people on the ground, technical experts, lived experience experts on the priorities that they should be amplifying on behalf of the government of Kenya, of Morocco, or Argentina. There's a lot of opportunity to kind of work on national level advocacy. I know the AAKP has a very kind of broad-based constituency from a global dynamic. As a US-based organization, you also can sit in New York with missions in a different kind of way than a lot of our advocates and collaborators that we work with. The negotiations are happening by governments in New York under the missions. WHO has a facilitating role, but we're not setting the agenda. It's coming from the member state co-chairs and the member states negotiating the process. And so I think right now we're in a phase where it's in kind of everyone else's hands to really do what they can to amplify the things that they care about. So the priorities for you as the kidney disease community, both from a lived experience standpoint as well as kind of across the clinical and academic expertise that you have. Having those conversations, whether it's sharing briefs with missions or developing technical materials that they can follow, suggesting line edits to the current draft of the political resolution. There's a lot of scope right now, especially I would say May to July is your big window. Negotiations do often carry through August as well. And then beyond that, beyond the political resolution, beyond what gets adopted and endorsed by the set of negotiating governments in September, I think something that's been really exciting to see, and I know we're going to talk about it a little bit more as we move the conversation forward, is the sort of mandate for lived experience, expertise, and collaboration within governments, but also within WHO moving forward. I think as the framework launched, as we're seeing more and more of a groundswell of support around the ways in which people living with conditions like chronic kidney disease or kidney disease can get involved, not only on the advocacy side of things, but technically in the development of guidelines and policies, the implementation of programs. I have excited. I can share some examples of that as we kind of move along the conversation. So yeah, many ways to get involved. It's an important time right now, in particular, to on the political process.
Yeah, and so let me ask something, Maya. So, looking into your crystal ball and knowing how these things work, so we get beyond the fourth high-level meeting, and then what happens? Are there? It sounds as though there's still many different opportunities to keep shaping on the implementation side, on the back side of that meeting. Do I have that right?
Yeah, absolutely. So for WHO, but also for governments, after a political declaration is adopted, that's the starting point. That's not the ending point.
Mhm.
There is the commitments that the governments are agreeing to follow up on within those political declarations, and so us as WHO continue to support our constituents, which are member states, in that follow-up of the declaration. It sets the sort of mandate and goals for what governments are meant to be doing moving forward. And for us, it's kind of that focus on providing the technical and normative guidance. I obviously can't speak to the priorities of every team across even just our division within NCDs, but there has been a really exciting kind of shift towards more and more opportunities for civil society engagement, but in particular meaningful engagement and really embedding in lived experience as expertise. One of the things that we have been working on beyond the work of the symposium on the global advocacy priorities around the high-level meeting is the EMER region, the WHO Office of the Eastern Mediterranean, has been directly implementing recommendations from the framework in 5 countries, which is the first sort of funded support that a regional office is providing a number of governments to kind of do country level dialogues with their lived experience communities and setting priorities in Syria that has meant looking at improving mental health support for cancer patients. In Morocco, that has been developing a stronger, more coordinated coalition of lived experience led organizations and civil society platform. It's been really exciting to see the sort of difference in priorities happening at country level based on the input and co-design of lived experience communities. On a global end, there is our technical teams are doing this, and then we will be, so as the GCM, we will be the next phase of the work for the symposium will be moving from this global advocacy to developing an implementation toolkit that pairs with the framework. So it will allow us to kind of, there will be consultation opportunities, many moments for us to be in touch after this summit in terms of building out that technical guidance on how to bring people into technical committees, how to involve people with lived experience in participatory research, in monitoring frameworks, and it'll be a module-based implementation toolkit. But then the other component is our individual technical teams are doing the same thing. So we were just an example of that. We were just asked by some colleagues, there's a new guideline coming out for hypertension, and we were just asked to help weigh in on a process that will allow people with lived experience to be part of that from the very beginning, and helping to co-design those technical guidelines. So we are just ramping up on some of these with some teams, but there's been teams within WHO that have long-standing work in this space, and so we're continuing to commit to building that capacity within the organization, and we're seeing that interest and commitment at government level as well. So it's definitely an area to stay tuned, and then and to also tell us where you're not seeing it, and to continue to encourage us to build more platforms than what you're currently seeing. So it'd be great to stay in touch on that conversation.
Oh yeah, no, we will, and it's exciting to hear about your colleagues reaching out to you on hypertension, since it's such a huge contributing factor to kidney disease and obviously heart disease, which many in our audience watching can relate to. And speaking of our audience, I'm just kind of curious, when we meet with an official or an official comes to the global summit, I'll often ask this question in particular, which is, you're at a key vantage point where you hear from people all over the world about non-communicable diseases of many different types. And you understand the connection between chronic disease, your ability to stay in the workforce, maintain a job, how it can drive people into dependency and disability. And I'm wondering if you could tell us how, in your role at WHO, hearing those stories of people impacts you as a professional and personally, and informs your work.
Yeah, I mean, I think uh, it impacts all of our colleagues, and it's been really important to see that conversation across all of our colleagues. I'm also a lived experience advocate myself. I was diagnosed with Hodgkin's lymphoma when I was in college, and severe immune deficiency disorder a few years after that in grad school. And so seeing that within my own life, certainly in an American context, I was able to access insurance and treatment, but you see the inequities in access, in systems, in within a U.S. context, and those gaps in privilege, but then especially in terms of global equity, and that's motivated a lot of my work throughout my career within WHO. there, and something that's been really unique and exciting to see with the symposium is there is a camaraderie amongst those of us who are lived experience experts. We come from very different countries, we come from very different contexts, we're dealing with very different challenges, but there is an understanding, a camaraderie, a kind of common ground for all of us, regardless of the condition, the community, the identity, the challenge, the systems gap that you're facing. And so there's there's a lot of responsibility in this role to make sure that we're trying to we're properly capturing all of the important insight and context that we are getting across the community. There's also this really incredible team effort to really work together across. You see it with our symposium steering committee. It's 9 different. I'm WHO. I'm technically also lived experience, but we have 9 other lived experience advocates who are in kind of this committee role where they all have their own backgrounds, their own personal expertise. But you can see, and we talk about this regularly. It's not just us coming in with our own story. It's us coming in with our own stories, but also the responsibility to represent our communities or represent the people who can't always make it to these spaces and these conversations. You can look at my own personal journey in a very linear way where I was diagnosed in college when I was studying global health. Um, I didn't quite put it together that a career in global health could also be linked with my own personal story in terms of cancer and NCDs, because so much of what the narrative around global health at the time was a very infectious disease related story. And so that was a whole journey that looks really linear on paper, but took a couple of turns. The other thing that I was working with an NGO, Partners in Health, the Secretariat's based in Boston. It's a very social justice oriented organization. I was doing a lot in my work supporting our NCD programs to amplify the stories of some of the patients that we were working with. And that felt really personally meaningful to me as someone, given my privilege, given what access I had to care in comparison to some of the communities we were working with and some of the poorest countries in the world. But then in 2017, when the Affordable Care Act was threatening a lot of us with high cost health conditions, it was suddenly a priority for us to hand me the microphone of my immune disorder can cost $60,000 to $100,000 out of pocket in the United States if you're not on if you're not on insurance. And so shifting into building my own skill sets and lived experience advocacy, and then the way that has inspired the sort of work that we do to provide platforms for other people. And I think at the heart of the work with the framework and with the World Health Organization, it's been about what platforms that we can create to represent that diversity of experiences to across all of our regions, across all of the contexts, the communities. We have advocates living with autism. We have advocates living with rheumatic heart disease, with complex mental health disorders. We have advocates working in humanitarian and emergency settings who are struggling in countries that are affected by climate change, that are in areas of rural poverty and areas of urban. Like there's so many dynamics and so many stories and so many. It's not stories alone. It's the sort of expertise and the impact that we can collectively bring. I think is really really powerful. And so it's been exciting to get to know your work as the association, and I think there's so many opportunities for us to work together. It's World Health Assembly right now, so for anyone following global health, I have colleagues who are texting me all week telling me how much the conversation has changed, how many ministries are talking about meaningful engagement, how many lived experience and civil society advocates are talking about that in a really powerful way. And so you can see that culture shift, and it's something to really build on.
No, we're very proud here in the U.S. and across the globe on the efforts that we've taken to not only get patients at the table, the receptiveness of governments here in the U.S., the U.S. Food and Drug Administration, the National Institutes of Health, the U.S. Department of Defense have welcomed patients to the table and their patient insights, and it's fantastic to see it happening across the globe. I appreciate you sharing your personal story. You know, you can tell over time when you work with people that there's an academic approach to some things, there's a systems approach to it, and underneath it, the most impactful engagements I think we have are driven by people who have been there. And there's so much that is said and unsaid that fuels their work and their passion. And we have deep respect for your story, Maia, and we understand it in many different ways. And I know that the audience um, will be cheering for you, clearly. And speaking of which, our audience is comprised of many different people. We have patients, we have families, we have researchers, we have policymakers. And I think, given the vantage point that you have with the WHO and the work that you do with UN and other bodies around the world, for patients that may not be that familiar with engagement or might be considering it, but for whatever reason, fear, lack of confidence, maybe they haven't had an opportunity yet. On a final note, can you tell us why all of their voices actually matter and how they can have an impact? I think, coming from you as a person with lived experience, who's gone through, obviously challenges as we all have, I think it's important for people to hear from somebody like you on why their voice matters.
Yeah, absolutely. And something that you framed in that question was around the sort of multi-stakeholder aspect of this. It's important for us to have our own safe spaces and our own conversations, and to kind of have that connection amongst each other and the way that we understand things differently than other stakeholders. But I think the power that we can really deliver is being in the room with and in conversation and co-designing with other stakeholders, with our clinicians, with policymakers, with academic. Many of us who are lived experience are also many of those things. We talk about integration in our own personal story across conditions, but also across types of professional expertise. And so to really kind of continue to raise our voices in those high level policy discussions, in the implementation of programs, there is a level of understanding both of the gaps and challenges that we face, but also what are people-centered solutions, and what does that mean, and how do you build things in a way that has us at the center and our families, and it's really important to have that dynamic in the way that we are developing and implementing policies and programs. I think my other point here is we've been working so hard to be in the room, and that's starting to happen, and that is really exciting to see. Now I would actually make the challenge for us is to make something of it. And so where we have often for years been kind of talking about the importance for us to be in the conversation. Now I think we need to make a shift into sort of what do we have to say now that we're in the room. And so continuing to push for those substantive roles in shaping systems and implementation, but also through our expertise, calling out the gaps in the agenda. If you're seeing things in the political declaration that should be there, calling that out, bringing that to the table, prioritizing the most vulnerable, continuing to build evidence, investing in capacity building, building those coalitions. We're in an exciting place. The context, particularly in this country and globally, has become very challenging in global health. It's been exciting to see within WHO that despite the pressures on us as an organization, meaningful engagement continues to rise to the top. But we need it even more in the current context, to keep things kind of people-centered, equity-focused. And so I have a lot of faith in groups like yours to really drive that agenda forward, and really appreciate the work that you put towards that.
Well, thank you, Maya. I have to tell you that it's a special honor to have you with us, and you're an inspiration. And I think most importantly, you're one of the folks that are on the inside of an institution, working hard to institutionalize the mechanisms for patient voice and patient impact. And I can't tell you how much that matters to patients like us and patients that are yet to come and who we will never meet. But they will be able to say nothing about us without us because of the work that you and your colleagues have done. And that means a great deal, I think, to everybody watching. Again, thank you so much for participating with us in our global summit. And we will be getting the message out, encouraging folks to take advantage of the mechanisms that you and your colleagues have created to incorporate patient voice. So thank you very much.
Thank you so much, and thank you for having me.